All right, good morning, everyone. I'm Bob Ravenscroft, the Vice President for Advancement here at Bryan Health. With me today to share a little information on kind of the escalating pressure we're feeling here at Bryan Medical Center and across our system is John Woodrich, the President of Bryan Medical Center and Executive Vice President of Bryan Health. And also available for questions is Dr. John Trapp, our Chief Medical Officer. Before I get started, I just want to thank the Lincoln Police Department and other law enforcement agencies for pursuing the source and the distribution of those responsible for the fentanyl-tainted drugs that is impacting Lincoln and Omaha. Unfortunately, those impacted by these tainted drugs is resulting in significant consumptions of ICU resources. Couldn't come at a worse possible time. Related to this for the public, please know that Nebraska has a Good Samaritan law that provides exemptions from criminal liability for people who request emergency medical assistance for themselves or another person in the event of a drug overdose. So yes, we are stretched thin presently, but we are very responsive and the emergency needs of the community are not compromised. You're going to see from today's information that we're in a pretty precarious spot, folks. There's an abundance of misinformation related to this pandemic and hospital capacity. I'm telling you, we are being as clear and open and honest as possible. Bryan Medical Center is full, and it's causing some ripple effects across the region. In our case, it's not really it's both a staffing capacity issue and a physical capacity issue. That might not be the case for every health system, but across the board, we are all feeling the workforce capacity issues, and there's no easy short-term fix for this. So as we get into what's going on here, before I start, our midnight census was 541 at midnight. That is the lowest it has been all week. As you can see from the slide, as it relates to COVID, we currently have 66 patients hospitalized, and 61 of them are unvaccinated. Of the 17 patients presently in the intensive care unit, 16 of them are unvaccinated. Of the 15 patients on ventilators, 14 of them are unvaccinated. So obviously that's why we are continuing to encourage everyone to get vaccinated. And thank you to everyone for continuing to pushing out that information. Just another look at it. I know you guys have seen this chart before. Over on the right is where we're at essentially the start of the academic year. And if you go back to, right where the slide says September 1 of 21 or of 20, you can see we're starting at a much different spot this time. What we are also seeing right now is a little bit of a shift of where our patients are coming from. I think last week when we spoke to you, and as the media who gets the press releases, it's been predominantly driven by Lancaster County. We're beginning to see some increasing patient loads coming from outside of Lancaster County. John's going to speak to some of the pressures that is putting on us. Without further ado, here's John Woodrich.
Thanks, everybody. I wanted to cover some pretty important information in relationship to measures that we're taking here. So we have had a conversation with our physicians and entire medical staff, especially our surgeons, in regards to our surgeries and procedures requiring an overnight stay that can be delayed 30 days. We will not schedule until further notice. So what we've done is there's already been some cases scheduled. We're continuing to do those procedures, mainly due to the fact because people have prepared for them psychologically and made arrangements. But we implemented this on Tuesday, and I think that's what's had an effect. Of course, that's what we were looking for, of reducing our census overall. So that's why, as Bob mentioned, 541 is the lowest that we've seen now in quite some time. I want to add clarification that outpatient surgeries are not impacted by this decision. Those will continue. And as I said, surgeries already planned will occur as scheduled. Our medical staff continues to work right alongside of us in evaluating the scheduled cases to determine if any of those can be delayed. We're making all efforts to assure that we could continue to handle the population of patients that are acutely ill and are looking for services here at Bryan. So surgeries and procedures will continue for any surgery that would cause serious harm to life and limb if delayed. So I want to assure people of that. And we do have unanimous support by our medical executive committee. You know, these are very tough decisions to make. No one individual makes these. We sit in a room with our medical staff providers, and we talk about what we're seeing and witnessing here and starting to prepare for what we know is going to be occurring here in the short future because we've watched what have occurred in other areas of the United States. So this will just give you a little bit of our census. Monday at 550, Tuesday at 578. We made the change, so we saw a reduction in Wednesday, a further reduction in Thursday. But I do want to comment when you see those numbers, and I'm going to give you a scenario of Tuesday. Tuesday, we had 578 patients here. We were holding 30 patients in the emergency department waiting for an inpatient bed to free up. And at that same time, we had 14 other hospitals that were holding patients that they wanted to refer into Bryan. That's why we made this decision that these elective cases, if we can hold them off, it will allow us to take care of people in this region that have more acute care needs. So since we've been speaking with you over the last few weeks, we now have 4 dedicated COVID units. We have other units that are periodically caring for more COVID patients, but we are making plans to continue to open up additional units because we know this surge will continue. But, you know, we keep talking about this vaccination. Folks, it's making a difference. If you see in those numbers that Bob shared with you, how many of these COVID patients that are in-house are unvaccinated individuals. And if we don't start addressing this, it will limit our ability to accept transfers. So we've made this decision about these surgeries and these procedures so that we can continue to accept transfers. I want to tell you, our staffing models have reached capacity. And this isn't unique to Bryan. We're seeing this across the region. We have utilized traveling nurses from all over the United States. Those companies are even having a difficult time of finding individuals that are willing to come to different locations. So it really has stressed our staff. You know, we're converting adult units to pediatric units because we're seeing a high level of pediatric patients here. A lot of that is due to RSV hitting, but as well as COVID. We're converting non-clinical spaces to overflow units to try to handle the patient demand and volume. We continue to work with the other health systems in the region. We work with our health department of getting the proper communication out to people and just letting you know what is happening inside the walls of these hospitals. We're looking at other measures as well. One, we'll be looking at our visitors. You know, we tried to open that up. I could see us here in the near future having to restrict visitors as well. Our goal is to keep the patient safe in this organization. We want to keep our staff safe here. We want to keep the provider safe. And that's why we're taking these measures. With that, I would like to open it up to any questions that anyone may have.
All right. The first question, I think we can all three address it. It'll be a great one for Dr. Trapp. We've heard about compassionate fatigue among doctors and nurses. It's hard to read. Treating patients who are unvaccinated. How do medical professionals deal with that feeling, knowing that sickness could have been avoided? Yeah, it's fair to say there's a different level of maybe frustration. The staff still gives it their all for every patient. Dr. Trapp is a pulmonologist by trade. He's up there. You'll be great to address this.
Boy, this is a real challenge. You know, we take care of patients all the time that have had illnesses that occur because of self-selected behaviors. Smoking would be an example, potentially. You know, we've gone through this pandemic for the last 18 plus months, and we've seen the damage it can do to bodies, to the lungs of individuals. We all were hopeful for a vaccine at one point in time, and before we really had nothing we could offer patients except good supportive care in the hospital. With this current round, we do have a defense for this virus, and that's the vaccine. And when we see patients admitted to the hospital that have been unvaccinated, generally from choice, or they didn't get around to it, or concerns about it, it saddens us. I would say providers are really saddened by it. We're frustrated by it. We're frustrated that the information that you may have received isn't always accurate, that you're making decisions that you think are in the best interest of yourself based on information that sometimes isn't always portrayed in the right light. So it's a challenge. There's lots of hours put out. It's hard to take care of patients that are not doing well, not able to have families present in the room. Those are some of the challenges, and that's experienced by our providers as well as our nursing staff. So frustration, sadness, the thought that this is preventable. We don't like to see anyone get sick, and when we feel like this is preventable, that's what really tugs our hearts, and we just encourage people to get vaccinated. Some of the success stories that we've had, and I've heard from our providers, are when they've talked to some of the patients who have been very sick in the intensive care unit who are able to talk, and they've been able to communicate to their families, and their families rally around them and go ahead and get vaccinated. Those are great stories that we hear and give us hope that the message will get out, and we'll see more people getting vaccinated to really prevent potential harm. Thanks.
Just to add slightly to that, because I had the all too common but unfortunate pass by as I was moving through the facility of a compassionate care visit that had just ended, and it is gut-wrenching to see our physicians and our chaplains walking those people out after they've just watched their loved one pass away. And as a point of reference, I know we shared information late last week that this is since on August 9th, we had recorded 247 deaths over the course of the pandemic. From August 9th to now, it's already 261. When it comes to hospital capacity, how are we better prepared to reopen to this surge? Are we in a worse situation? I'd say that, and I'll bring John back up, Dr. Trapp, if you have something too. In one way, we've been through it, so it's going to be easier to fire some of these other things up. I think we're in a very different situation because of everything you've heard, how rapidly moving and virulent the Delta virus is, and the staffing concerns make the situation a little bit more tenuous.
Thanks, Bob. I would say we're better prepared than we were before. In fact, as the surge started to decrease a while back, we actually pulled a variety of people together to talk about lessons learned. What could we have done differently? What could we have done better? And we put those into place. But I think as you heard Dr. Trapp explain, it's frustrating to us from the point that we could have avoided this. And we're trying to just get the proper word out to people about the vaccine and about the stress it's putting on the organization. We have 5,000 employees, and it's hard to watch them go through this again. So we just think you could help us make an impact, and we're trying to do the right thing for the community in the region. We are prepared to handle it, but we shouldn't be in this state again.
When it comes, let's see, do you currently have any pediatric COVID patients? And can you say how many are hospitalized because of RSV? There is some good news here. First of all, there are no pediatric COVID patients today. There was one earlier this week, so that's good news that the little kiddo is home again. As far as other respiratory viruses we're seeing, I'll let Dr. Trapp come up, but today we have 11 pediatric patients, which is lower than it was last week. So we're going to take that as good news, and we'll take good news when we can. You want to talk about other things there?
As far as pediatrics? Yeah. So Bob just mentioned some of the pediatric units. Certainly last week we were having high census related to primarily RSV. Children's Hospital has also been relatively full with a number of different pediatric viral illnesses. Those have attenuated a little bit here this week. But my understanding also is that Children's Hospital still has some limited capacity in certain areas, and that raises concerns. So continue to provide good community-based care for our pediatric population. We've got a great pediatric hospital service to able to provide that care, and who are very well connected with specialists at Children's Hospital.
How concerned are you about the ability to bring in transfers from other parts of the state, considering few school districts have any mask mandates and vaccination rates are very low in rural areas? I think that's, the font's real small. I think that's from Andrew. Yeah, we're very concerned. As John shared, we are in an unusual position of having to delay some transfers. That's not what Bryan is known for. It's causing pressure as things back up throughout the state. And you guys have been following this from the beginning. We know that the preventative measures of wearing masks work. The low vaccination rates is one of the factors going into the modeling that makes this a pretty ominous situation. I don't know. Is there anything else to share on that? Okay. Let's see. Is the coordination of available hospital beds between hospital systems still in place? We talk daily with Dr. Trapp does with chief medical officers, John with the health department, Russ and John with other hospitals. So there is coordination. John, you might know as the Knowledge Center thing being reopened.
Yeah. I don't know if the Knowledge Center is officially open, but we are communicating quite a bit between the hospitals. I will share with you, every hospital is feeling this right now. And, you know, as I mentioned to you, we're prepared. We're prepared for what had occurred before, but I have to tell you, I truly believe these numbers are going to exceed what we witnessed back in last November. So if you look at what's happened in other parts of the country, and we're probably in about a 4-week surge of what most people are seeing to be an 8-week, and the numbers will continue to climb drastically. But on top of that, we've had schools opened, we've had a big concert occur in this town, and we're going to have football games and all those events happen. So we're as prepared as we can be right now, but I think as we watch the numbers continue to go up, that's why we've taken the measures we have on the elective surgeries. You hope you never get to a point where you're going to have to really make some tough decisions on who comes in first. We don't want to be in that situation. That's why we're sharing this information with everyone. Get your vaccine. Be careful when you're out there. Wear masks in those large crowds. Distance appropriately. You know, people that are vaccinated, even if they do get COVID, it's much less severe. And that's the message we're trying to give to you, and we're trying to do the best to service this region like we have for many years.
Are there enough emergency funds available for patients who don't have insurance since you are limiting elective surgeries? I don't think I quite understand that question. What I would add is we have a financial assistance program in place for COVID, non-COVID patients. And, you know, over the course of a given year, we subsidize care through what we call community benefit. It's either unreimbursed components of government care or straight out charity care that approaches $100 million. Those are not funds that come from anywhere else. It's part of our nonprofit mission. So maybe if you have a follow-up question on that, Andrew, get to us offline. But if people need care, regardless of their ability to have insurance or not, they should seek it. The next question is where is the disconnect or disinformation about hospital capacity coming from? It doesn't take long to see it, or certain statements that says hospital capacity has not been an issue. We're telling you we're full.